saved this country, invested their time, skills, and all to bring us to where we are now, that dignity is not restored by the systems that are created. So that's the reorientation that NSCC is doing. We are working with many ministries. We got in the last administration of President Buhari, who did well to assent to the bill and made it an act. He gave us a directive. He gave us a directive that yes, we can work with NIMSI, so that based on the NIN, the national identity number, based on the national identity number, we can now go ahead to issue a multi-purpose identity card for our senior citizens. Those identity cards will serve for discounts, because now we are working everywhere to get discounts. I'm hoping that FCT, they will float the buses where older people can get reasonable discount or even go for free with the card. Railway, the same thing. And it is also priority card, so that when you see somebody flash that card, you know that you must give way and they must have priority. So we are trying to put these age-friendly systems in place to restore that dignity, that respect for old age. And then, of course, we have the continuing engagement. That's another pillar. How do we keep retired professionals, retired technocrats, retired artisans in their areas of expertise? How do we keep them engaged? You find some of them, as soon as they retire, they are looked down on as they cannot even go back to where they worked. They are looked down on as a waste. They go back, they are forced to go back to their states of origin. They have worked in the cities all their lives, and before you know, they fall sick and they die. So we have created that portal. Our advert is running everywhere now. So older persons who have retired as professionals, technocrats, as artisans, even those ones who are in multi-purpose cooperatives can upload their profile. And then on that same portal, we are appealing to all the agencies, be it government, non-governmental organizations, agencies that need the expertise of older people with the systems that we are putting in place is a generator of income. Our youth will have a place here to work. That's number one. Number two, our retired professionals and technocrats. Already we have signed an MOU with one top youth development enterprise organization. And we convinced them to use our retired professionals and technocrats as facilitators. And it's going to be a national program. And they are looking for 1,150 retired professionals and technocrats. So we are creating a system that will continue to engage our retirees, their prospects, economic growth prospect. And the best prospect here is the restoration of dignity, is the building an inclusive society where older people are not looked down on. Making our youth look forward to aging and making the working population be joyful that once they retire, there's an oasis waiting for them. That's the prospect. So if this agency is funded, we are sure you will reduce unemployment. And then, of course, with the economic growth, because we have a community social enterprise approach. When we enter a community, we bring a multi-sector into that community. Whether it's health, because we leverage on our multi-purpose. So the prospect is community development, community empowerment. We don't just pick one older person and empower. We enter the community and we empower the entire community and build our one community, one senior citizen center. So that's the prospect. But there are huge challenges. Distinguished senators, one major challenge is the attitude and perception people have about aging and old age. Even policymakers across the MDAs, anything that has to do with national senior citizens or citizens, they look at it as welfare. It's as if it's a waste of time and a waste of money. I give you an example. In the National Development Plan, we developed 11 international standard projects, but 4 were dropped. Why were they dropped? Because they could not understand. Why are we developing programs for income security for older people? Because all they know is pensions. All that has been in their head is pensions. Why are we developing continuing engagement program? So it's an attitude thing, that perception. So we need reorientation at every level, at the Senate level, distinguished senator, policy making level, up. So we need that. That's one challenge, because older persons are not included. And then that now brings us, because of this attitude, our budgets. I may say without contradiction, that maybe the National Senior Citizen Center budget for these 2 cycles is the lowest. Our capital budget in 2022 was 300 million as an agency taking off. And then in 2023, they reduced it to 250 million. We have written, we have advocated, we have begged, we have brought proof, but nobody wants to listen. And so when we write, for instance, now we are supposed to build at least 7 model senior citizen centers where we have already developed the standard operational manuals for them to see that older persons don't need to enter their homes and die. There's a geographical place they can congregate and continue to mentor youth and continue to do lifestyle coaching and enjoy themselves. They have suffered. All those were dropped. Nobody's listening to us. So my plea, distinguished senators, is if we can reorient our budget administrators, policymakers across all the MDAs, maybe you hold them to accountability to show you where exactly in their budget they have allocated the percentage they've given to older people. That will help us because we already have aging deaths there. So if each one comes before you and says, for senior citizens, we should respect. And I want to believe that most of you in this committee belong in that category. There's no respect and there's no budget attached. So most of the things you see us that we've been able to do is by the goodwill that I came with from the UN sector and the AU sector. And they're still, funding a bit of these things. If they should give us the money that we want, all your communities will feel the impacts because 70% of our older persons, they're in the rural areas. They're in your community, in the local government, and we want to be able to reach them. And the second challenge we want you to help us with, please, is that the National Senior Citizen Center Act, as would be amended, the executive governors should be, please, influenced to domesticate the act because it has so much to offer our senior citizens there. And then the act as it stands now, we will really love, and in one of the documents that we presented is our proposed, what we see in our head that are the troublesome spots where you can help us, and we are willing to really work with you step by step if you allow us to really make it robust. I also added that a month ago, the president, Bola Tinubu, graciously led the Federal Executive Council to approve the ratification of the protocol to the African Charter on Rights and Peoples and Human Rights and the Rights of Older Persons. That's the African Regional Convention. So having approved that, because the instrument is being prepared now to be deposited, we now have included that protocol in the documents so that when the amendment is there, then you can look at the protocol and the clauses in the protocol and see which one, so that we don't have to do it twice, go and come back, and see which one you may wish to choose. Thank you so much. Thank you for giving me this audience.
Whether you like it or not, whether you are born today, the target that you are going to reach, that 70. I find this amusing, except for some of us, the elites in Nigeria. A lot of Nigerians don't actually know the existence of this senior agency. And this is an act that came into being just 2017, about 4.5 or 5 years or thereabout. I run down through your submissions and your budgetary allocations. I'm wondering whether you are still on a pilot scheme. On a pilot scheme in the sense of what you are planning to do going forward, funding opportunity, when funding opportunities arises. First of all, I'm not sure you are adequately communicating to Nigerians as far as this agency is concerned. I can tell you I'm from Bauchi State. And if you go to Bauchi State and ask the 70 years old, all of them, whether there is an existing agency that caters for them, it is very, very difficult to get 10% out of all of them. So I don't know whether your agency is actually meant for Abuja. Even if it is for Abuja, looking through your budgetary provisions, a meager amount of less than 150 million. Are we really serious about it? What does 150 million do to the aged below 70? And if you go back to the statistics office, those above 70, they are running about 32 million to 35 Nigerians are above the age of 70. And here you are, you have an agency that runs on a budget of 150 million and only receive about just half of it annually. So what are we, how are we going to rectify that? Because this is a very sad situation as far as I'm concerned. I'm not sure the executive, your own body, actually do appreciate, do understand what you ought to be doing. But the National Assembly, it sits on proposal and we look at it. And even the 2024 proposal in your budget is not a departure of what you have received in 2023. It's not a departure of what you received in 2022, 2020 and 2021. So how do you make sure that, how do you intend to make sure that this agency has a feel, has the pulse of all those aged seniors who have actually laid their lives in bringing this country to where it is? So I'm not sure, Mr. Chairman, whether this agency has sufficient wherewithal to be able to do this particular job. However, we are before the House Committee. We want you to just give us a summary of pilot scheme you have run in this country. What do we do? Making sure that finding out it has been run and what is the end result. But I can tell you what I have seen so far on paper. I'm not sure whether we are prepared for taking care of our aged in this country, and we must. And we must. It's our duty. It's our cardinal duty. Everybody will reach 70, God's willing. But so far, I'm sure you have to bring other methods, other techniques in making sure that the aged is actually awareness of what your agency does. Thank you, Mr. Chairman.
First condition to be aged by force. That is coupled with the civil unrest, wars, and so on. Internal displaced people. People that are young and are being fed, they grow. So your act, as what my distinguished colleague Abdul Negi read out, is 40. Before that 70, you will see that at least a lot of almost senior adults that are supposed to be productive will have been killed by poverty. Now that the exchange rate is up and the drugs could not be purchased, you see people dying easily of malaria. Today they see somebody, tomorrow is gone. So maybe you will still go back and reappraise that age something to almost 60. Just immediately after retirement, somebody becomes a senior citizen. You see that before they even get to 60, at the civil service, they die. The problem of promotion, non-promotion, how to feed school fees of all the children abroad here and there, it make everybody to grow old suddenly. Then, last year, about 2 years ago, we asked you that in my village, we don't even know whether you have this agency. Talk less of Borno that are having a lot of IDPs, and most of them are old. In our palaces, you have a lot of old people and they are even educated. The publicity of this agency is too low. It's a very good agency, very big one, that should even be recognized by the Constitution. These are the brains that the nation has used And they are supposed to be the reservoir of wisdom now to what is going on. So, in abroad, they take care of them. There's a scheme in London. When you grow like this and you retire, there is local? There are a lot of facilities that they enjoy, including housing. Old people's home. Like in my town now, Senator Olubi will be able to testify. We have what we call geriatric hospital under the geriatric social systems. I told you that you should send a delegation from your office to go and see what they are doing there for the aged people. There's a big hospital now that we contributed money, all our people DJs has. We contributed money. That instead of old people to go and queue in general hospital, teaching hospital, they should go to that place. It's purposely meant for them. Maybe brought the age down to 60. It's being managed by teaching hospital. It's the same thing you should have introduced to them in Boroni. They will contribute money, build a good hospital, particularly in Meduguri, for the aged. You will see that they will not worry to go to general hospital again. These are the, and two, local government, they have their own. All those retirees, teachers and so on that are taking 11,000 naira a month now as their pension. They die easily. Provide social something, their social geriatric system for us to allocate money for our future. All of us will grow. Then what are we putting forward for us to go back? If you are not fortunate, if you are not fortunate to be senators, by now we will have been head of the village, head of the communities, and there are no social services for us to enjoy. It is your own duty now to start on a serious note, not on a 300,000 naira that can be dashed away by anybody. Then you appeal to all these big industries that we still have. You are not appealing to them. Appeal to big industries like my brother Dangote, Bua. They are growing old too. They will contribute, but your advert is not going there. If you go to Abayo Institute, Victoria Abayo Institute today, you see how Zenith beautify the whole street, long street with street light. This is a Christmas light until January next year. These are the part of donations that will have gone to the old people's home. You target, then you now attract foreign funds. These are the areas I should be able to talk to you. The publicity must be accurate. Then we must see seriousness in you. Not that you give us a bill of budget of about 300 million and you want to perform. Thank you.
I feel sorry for the agency, for the stress you are being put through this meager allocation. We are a population of over 200 million, and I'm sure a very substantial percentage of this population are already aged. And to be given a paltry 300 million to run an agency that is supposed to be concerned for the aged, I think is unfair to the senior citizens of this country, especially those who have contributed positively to the growth of this country. The most unfortunate thing is that most of our pensioners today fall within this category, but they don't even have the money to go to where their pension is to be collected. And if they do find money to go there at all, they don't get paid. They suffer. We see them crying on television and nothing is being done about it. Your agency, I think you should liaise with this committee of the 10th Senate, most appropriately because you have a young chairman who is sympathetic to our cause. You have senior citizens who feel the way you feel. And I don't know what your agency is doing to liaise with the necessary agencies that are supposed to be taking care of these people who are supposed to be collecting their pension, which is just nothing to buy drug for 1 month, not to talk about food. And unfortunately, some grow old and die without siblings. Some grow old and have siblings who are not responsible to take care of them. And this old people's home is not being encouraged in Nigeria because we are our brother's keepers. We want to take care of our aged in some few communities. But I have found something on your act which I feel disturbed. And since I heard you talking about amendment, I think it would be appropriate if this act is amended and this clause, section 18, if it can be removed from this act, because section 18 says a senior citizen who suffers from a contagious disease or who is mentally unfit or unsound and whose behavior is inimical to other senior citizens as determined by the National Center on the basis of appropriate certification by a qualified government or private volunteer physician may be denied the benefit provided in the National Center. My understanding of this is like the center is being treated like a nursing home or a home that all aged people are kept. The examples we have all given here, every old person lives in his community. It is your responsibility to see how their welfare can be improved, how they can die peacefully and happily. But this clause, if somebody is old and he cannot feed, he cannot get money for medication, and he is befallen by an ailment, how do you discriminate against him? So he needs more care. He doesn't have to be despised. So that, because if you despise him, you are just saying he should go and die quickly, because frustration alone will kill him. So if we are going to amend the law, I feel that this section should be expunged or should be moderated. The National Civil Senior Citizens Center is not a nursing home. And this one, I think this clause is specifically meant for a nursing home. I think that's my contribution.
The lawmakers suggested the way out to make the agency fit for purpose.
Even up to a year. And that is how even I discovered the existence of the National Senior Citizen Center on NTA, particularly on NTA. There was a time it ran continuously. That is when I discovered of its existence. But there is a need maybe for us to take it down to the local level, to the NTA stations at the various subnational levels, so that people in the grassroots will know, maybe translated into the various languages at the subnational levels. So for that, I think a step has been taken towards at least publicizing the activities of the center. Then the other observation that I want to make is in tandem with observation that was made by distinguished Senator Anao. Because of our culture across the nooks and crannies of this country, whereby we take care of our parents, of our aged, no matter our circumstance, we to the best of our ability. It runs across all the cultures in Nigeria. We don't allow our parents to go to senior citizens' home or nursing home. You will be despised. You allow your parents to take your parents to old people's home. You will be despised as if you didn't take care of your parents. So I think that aspect should be exposed, and we should look at a model to take care of our aged without necessarily taking them to old people's homes, because our culture frowns at it. Across the nooks and crannies of this country, I don't know of any culture that allows its parents to be taken to old people's home. Thank you.
Meeting the governors or asking the governors to domesticate, you need to liaise with to ensure that the state and local governments are being carried along. All this explanation we are making here is because we don't know about the existence of this agency back home in our villages and our states. So if you do that with the committee in the Senate, I think it will go a long way, and the law will be domesticated in the states and also be replicated in the local governments, so that it will be people will be fully aware of the agency, both in the state and national at large. Thank you.
There's a problem here. Is it that you've been created to just do nothing? I think, Mr. Chairman, there's need for us to at least engage the Committee on Appropriations, and from your own side, you must engage the Budget Office and Ministry of Finance, because this is a joke, to be honest with you. How can you, look, we are all looking to live to those ages, and if you're being treated like this, people, the old generation who catered for us, made Nigeria what it has become, all the hard work they put in, and then this is the kind of reward we give. I think this is something that we either scrap it or we fund it properly so that it does what is mandated, what is supposed to be mandated to do. Because this thing is, to be honest, I don't know who drew up the budget for this center, sir, but it's an embarrassment, it's an outrage. So, Mr. Chairman, I think we have to at least find a way to provide the necessary appropriation that at least they can be said to be doing what they are meant to be doing.
Something about UN and so on, but in your act, there should be a place for partnerships. I don't see it. There should be somewhere that provides for partnerships. What I'm saying is that there are a lot of partnerships that you can collaborate with. And I can tell you right away that when you're talking about age-friendly society for senior citizens, most of them, their major problem is loneliness. And loneliness brings sickness and death faster than any other thing. And a good number of them, while they are still healthy and they have left formal work, would like to give volunteer services. Just volunteer services. It takes them out. It makes them physical. I mean, they have some physical motion, something to do, instead of just sitting and waiting for their children or their grandchildren to call them up. And so if you collaborate with these partnerships, you can provide areas for them where they can feel useful by volunteering services. Because it's not always about what funding they can get. It's about how the dignity that they feel, that they are recognized and they are useful to their society. And I want to also add to what our distinguished senator said about this disqualification. I am chairman of the Health Committee, and we're trying to work for what is called a Vulnerable Group Fund, VGF, which works through the National Health Insurance Act that was signed in 2022. And this VGF provides funds for insurance cover, health insurance cover for people, retirees, those over 60 years old, and other categories. But obviously, senior citizens will come into these categories. So I think that you should bear that in mind when you are looking for funding for the health care of these citizens. Thank you.
Everybody have elderly people at home, both father and mother. I'll give you a story of myself. I'm the last one of the family, and my dad lived up to 95 years old. When he was 90, I think he fell about 3 times in our house, back in my village. He has a driver, he has a nurse, but he locked himself in his room. They had to call me because my siblings, were able to pull him out from the room. That's even we are educated. We have the luxury. The vehicle is there, the driver is there. So in my own mind, and I said to myself in my community, how do I be able for little emergency of such? If we're not able to call people around us to pick the old man to the hospital, that's the end at that point in time. This happened about 3 times. And I said, okay, yeah, we need an elderly care commission in this country. Elderly care commission. Your commission is not strong at all. And for our elders, even up to Mr. President, is elderly now. They should put a priority into funding from the presidency. A priority. It's not about women, elderly women. We have elderly father as well. I'll give you another instance. My mom is a doctor, and when my dad was 75, you know what she did? She married a lady for my father. I said, what's going on? My mom said, your father needs care, elderly care, to be able to loneliness, which she has mentioned about it now. At a present age, they're not doing nothing again. And so, in a nutshell, I think the funding is the first priority. Without no funding, the agency is not going nowhere. You have your beautiful ideas, fantastic. I listen to it and put it down on my notes, but where is the funding coming from? So we need to address the funding, Mr. Chairman. Even in the committee of all, we have to address it properly. It should be a special fund. You have to run into the budget, Minister of Budget and Planning, the budget office as well. You need funding. Without no funding, the agency is not going nowhere. And of course, every household now, we have uncles at age 80, we have fathers, we have, and it's our responsibility. Every day from our constituency around us, we send money home for burials, to buy caskets, because we're not well taken care of. So I think, Mr. Chairman, it's a critical issue for this agency to survive. It's very critical. We have to look into it properly. Thank you.
Annual subvention or allocation received from the federal government. Apart from the budget, do you receive any other monies from government apart from your budget? Okay. C, such monies as may from time to time be granted to the center by the government of the federation, state, and local government. Do you also receive money from state or local government apart from your budget? No. Okay. Since your act has provided for it, and since it is not tied to a specific amount, and from the lamentations of my colleagues, I will suggest that in the process of the amendment, we request to the National Assembly that at least 1% of the federal budget is allocated to this center for the running of the elderly. They might object that 1% it is better for you to ask than if it comes to the National Assembly and the National Assembly approves it, there is no way they can, because all of us are going to get old. And even the person who is allocating 250 million to you is going to get old. He's going to leave his office, and he would want himself to be treated to such a good provision if it exists. So unless you ask for it, nobody will give you what is yours, particularly in Nigeria or all over the world today. What is yours, if you don't hold it tight, it will be taken away. And so I will suggest that you ask. If you ask for 1% and they give you 0.5%, it's a step forward. So I think I will suggest that you also, when it comes and it is not being followed, you can report to the National Assembly so that a committee for compliance will follow up the state and the local government to make sure that this is complied with. I yield my time, Mr. Chair.
Thank you so much, sir.
And these corporate organizations, big ones, and international communities, they will come in if you relay main business. Thank you, Mr. Chairman.
Though you are given a power to generate from different sources, at least the main one that comes from the federal government itself should be enough to sustain the place before you can look for other ones to add. It's actually very regrettable that the impression we have over there, outside there, is different from what you are seeing here. From my expectations, I thought that no ministry or NTA or department will earn anything less than 1 billion at the federal level. Because we keep on hearing stories of using more than 1 billion of naira to cut grass at the national level. We heard of how snakes can swallow billions. So we are thinking that every department MD should have more than 1 billion to handle. So as it is now, we've been assured we're going to get a cooperation to see that we beef up your provisions, your budget, to see that you are effective. I have not gone through everything to know the true definition of senior citizen, whether 70 and above, for everybody or for those who have served the country or otherwise. That's the point. So I'll take time to study it so that when next we meet, I'll also be able to contribute better. But I'm happy my colleagues have contributed enough. So we're going to work together in partnership and cooperation to see that there's improvement in that MDA. Thank you so much.
I have aged persons around. I know what our mothers and fathers suffer. And so the existence of this body, first of all, is our problem, because I'm not coming from nowhere. I've been a state operative, but not so much is known to me about this body from where I'm coming from. From where I'm coming from, we seem to only have government attention when we try to make agitations. And so even here again, maybe I have to agitate in very strong terms before I will understand or maybe carried along. And so first I want to ask, to which extent is this your agency or body been made known or established all over the country? And if you have not been able to put your feet in all the states, first of all, that should be your concern. And again, like other speakers have said, we have local governments, and all of the local governments have to be involved, because what I'm seeing here is too much for the enlightened persons. The people at the downtrodden, particularly in our regions, are not captured. And so I will want us to increase the scope, because if you go to the market, it's what you take to the market you will also use to price your goods. What you present to the ministry or to the minister or to whoever you are making your cases for is the amount of money they will give to you. If you provide activities that you want to run, and the activities are so convincing, like what we have been reading and seeing. If you go to an aged, facility elsewhere, you will see the aged people, they have a program. In the day, what are they doing? It is like a student environment. It's organized in that form. In the morning, what are these people coming out to do? In the evening, what are they going to do? And so, if you have all of those programs to run, recreational facilities, sporting activities, that will keep the mind of the man, refreshed, so that he will not think of his age. And so I just wish that you look at the framework that you are running, so that if you come down to the assembly is here, we'll be able to increase whatever you want to work with. You don't just come with an envelope, and then if the envelope is not suitable to our own environment, we have to look at it. It is not budget party. It is all about meeting the needs that is at hand. And so I would say that you maybe acquire the services of good consultants, and then come up with a better framework for us to look at, and then add whatever we think we can add to you. I want to thank you.
The agency was also advised to channel more energy to public enlightenment and expanding its engagements to states and local governments for more impacts to be felt by the targeted group.
In the last 1 hour or so, you've seen how members were so passionate about the plight of the aged in the country. Even those of us that are not yet there feel the pains, and we want our elders to be respected and dignified. As such, you have had a lot of questions and comments from these distinguished Nigerians from this side of the divide. You are also fortunate to have in our midst some of the committee chairmen that will also be beneficial, or some of these committees that will work hand in hand with you to strengthen your agency. We have the chairman Senate Committee on Judiciary, we have the committee chairman on health, and we have population. You made mention of need number. Get hold of Abdul Lingi, the Distinguished Senator. So you have the floor to respond to the various questions put across to you. Please go ahead.
I think a few of you were not here when I talked about our mandate and all the pillar programs that we have piloted and we have put in place. First, I want to address the fact that almost everybody says we really should improve visibility, that most people are not aware of the existence of the National Senior Citizen Center. Yes, the center, the act was in 2017, but the inauguration was late 2021. And for the 1 year between June 2021 and June 2022, we didn't have a dime, not one single resource was sent to us. So we're actually running this center from my house. And I want to say that another factor I want to say again, and that is where really the publicity is needed, is the mindset of the policymakers and persons. It's really heartwarming to hear the distinguished senator talk this way. But the policymakers are not talking this way. The policymakers see investment in senior citizens as a distraction from core investment agenda. So we have to constantly, we wrote for a budget, takeoff was 2.5 billion. They gave us 300 billion. And then last year we asked for 3 billion. They gave us 250 million. Even this year, it was 7 billion. We went to budget office, we have cajoled, we have advocated, we have pleaded, but that is the lens that they use to see senior citizens. It's a matter of attitude and mindset. So I think the amendment of the Act is what may break that. So it's compelled. That obligation is compelled. And then the distinguished senator asked me about what our pilot program, what have you done? And even I think almost every other person now said, for you to approach, you must come with a framework, you must come with, so I'm very happy to share a few of what we have done. In the first year, I want to tell you that since this has never existed in Nigeria before, care of older persons, a dedicated agency to look into the challenges of older persons. So we spend time to build the systems, the mechanisms, the processes, and the procedures for sustainability. So that should we approach a state governor, we say, well, this is the system, this is what we have piloted, this is the roadmap, this is the blueprint. We can partner with you, we can build your capacity on this, and then we can support you do this. So it is one thing to just get up and do haphazardly, it's another thing to really build the systems that you can share. So what we have done in those documents that we've given to you, you see that we took time to build systems. So I take it one by one. Now, what we have done under income security is that we looked at the challenges of financial security for older people. And we said this population category is not homogeneous. You have a diverse population. You have older people, like we have said, who are really frail, needing long-term care, needing real good access to health, and caregivers. You have older persons, on the other hand, in their community, they continue to work to earn income. But this is subsistence because it's from hand to mouth. So let's first look at this set of older people. So what we did, we entered into a partnership with the National Directorate of Employment using their statewide offices. So we carried out a national assessment of indigenous crafts and skills. Who are the older people and in what communities? Where are they? What are the major crafts that our older people are engaged in? In fact, we have published it. So that sample size took us to 18 states, 109 local governments, with our stakeholders enumerated plus our staff. We were in every village. And I tell you, we have published, we have identified crafts, indigenous, true legacy. And what did we do? We now said, let us pilot in all the states. So there is none of your states that we did not pilot in. Because of the limited funds that we had, we said, okay, 7 older persons each in each state. Let the stakeholders pick from the assessment, let's pick those ones that we can share this money. So the little money we had, we brought 1 million envelope. Let's share this amongst this. That was the first time they were seeing such grants given to them in indigenous craft. And we got NDE to build their capacity in going to clustering them in the senatorial districts, not building their capacity in the crafts because they've been doing this for 60 years and so, but telling them about good bookkeeping, motivating them, inspiring that now government is interested in what you're doing. So we were able to pilot that. We were able to publish that. You have their numbers and their names. We're now able to identify 38 major crafts and arts across the country with your states and the craft that are dominant in those countries. So what we did now, we now moved to SMIDA. So we are now clustering these older people and their children, the youths that we want to promote, to encourage to be part of it in multipurpose cooperative. I'm happy to tell you that there are even some, because of the nature of their arts and crafts, the beauty of it, SMIDA now took them now. They just finished the capacity enhancement for branding that they can now be taking them for trade fairs. So I want to say that for community prosperity, we have identified the indigenous crafts and arts that are mainly held by older people. And if funding comes, that is one area. Not just these older people, but their children. As I said before, our approach is community approach, social enterprise approach. You enter a community because the older people, we must strengthen the family around them. Just so when they are weak and their functional capacities decline, the children can be part of that profit that used to engage. Because it's not all of them that will now have social safety nets. But we can strengthen the family for them to be able to take the profit from the multi-purpose cooperative in the community. We have piloted that, and it is working perfectly. We now want to work with Sweden now to now do 3 multi-purpose cooperatives per state, each senatorial district. So that's what we are doing. As I tell you now, the implementation plan, everything is out. So we start with the state, identify and we are working through our stakeholders consultative forum. In Boronu, Sokoto, I will really be pleased to share, maybe I drop with the chairman, distinguished chairman, the telephone numbers of the steering groups in each of your states. We are in each of your states. We don't have the resources to build state offices. We don't have that resources. We don't even have the resources to build offices in a geopolitical region. We don't have. But what we have done with our limited resources is to build the mechanisms with human beings, retired persons, older persons themselves, plus CSOs. I mentioned the 8 major categories of stakeholders that we have mobilized. And in your states, we can call them up. In fact, sometimes when we want to talk about to the whole Nigeria, we bring them up. We invite them here, and then we go. I have been to see major traditional fathers across many states, and that is what we want to do. That one, then the subsistent farming. We have discovered that when you talk about agriculture and you talk about all that, yes, oh, okay, thank God. They overlook all the people. They are talking about mechanized agriculture. They are talking about central bank doing this. The older people that are eating from their crops are overlooked. So what we have done, in fact, we piloted in Ushafa, the Chape community there. We can take you there, sirs. What we did in that community was that when we were doing the national assessment, we just discovered that this community is peculiar. Because in that cluster, they have their pottery, women, doing the pots and all. They have the fishermen, they are selling fish, and then they have the farmers. So when we now wanted to do the multi-purpose cooperative, we said, let's pilot here. So we brought them all together. 43 of them are subsistent farmers. 94 of them are in fishing and selling. And then 23 of them are doing the pottery. So all of them, we helped them to establish the multi-purpose cooperatives. We negotiated land, 21.6 hectares from their district head. The land that belonged to community, and they were not allowing women to farm. We negotiated, got 21.6 hectares. Right now they are farming cowpea. We signed a off-takers agreement for the private sector who will buy off them. And while they are there, what we did was, as I said, social enterprise model. We now brought in FCT health insurance. We bought them health insurance as for people to see that this can be done. All of them are covered. We negotiated with the health insurance and paid 12,000 per person while we wait for the vulnerable group fund. We brought in primary care. We built capacity for primary care to teach this community the basic health package that they are entitled to and how they can navigate the health system. And then now we are planning to train their community health extension workers on how to visit the community for health promotions and all that. And we brought in Rwasa, WASH. Now they build their capacity to understand how to end open defecation. And even now, Rwasa is saying once they get their capital, they are going to build them toilets. WHO, we were able to convince WHO, the climate change aspect of it, come and help us do nursery here. Because that land, beautiful land, is at the bank of Usman Dam. So we have that, and that is what we will wish to replicate if we have the money. When we enter a community, we cluster, be they subsistent farmers, be they artisans, be they in any craft and art, whatever they want to do, we empower them. We support them to help themselves. We don't help them because these are vigorous people. They have dignity, they want respect. And we are talking to Smidan to follow us across this country. If we have that, that's what we piloted. And then continuing engagement. The distinguished senator talked about loneliness and talked about despondency. People, what we have done, we have built a very formidable continuing engagement bureau where all our retired, unfortunately, most people don't watch NTA. Everybody's on channels, but we cannot afford to go to channel because we don't have the money. NTA does this free for us. because we have entered that formidable partnership. So we are always on NTA. That jingle is for all our retired professionals, our technocrats, our artists. If you want to continue to engage, either on voluntary basis or you want to earn income through contract, please go up there. It's a social media. Put up your, I tell you, so many. And if you see the skills and the expertise, and the joy now is that that same platform, we opened it to organizations, development partners, government organizations. If you want to engage the services of these older people, you want to use their, we call them steady hands, people that have been tried and tested and are still willing to go. Now, put your request. So the data is overwhelming. I mentioned that we just signed a partnership agreement with a very formidable organization from Lagos, came from Lagos, having seen that to us. They are into youth entrepreneurship development. And I said, why don't you use our retired professionals and technocrats? They have all that you need, because I've seen the data there. And we signed that MOU. Now they are asking me for 1,150 retired professionals and technocrats who are going to be from the grassroots, because we are starting from the local governments where the youths are there. We build their capacity, and then they move to the state. It's competition. And every facilitator is an older person that has retired. So that's our continuing engagement bureau in that. And then somebody talked about volunteer. We have a program for volunteerism. We are creating those mechanisms where you want to engage them on volunteer basis, but we really have set up the age-friendly environment, the logistics, how you can engage our older people, because we don't want them to abuse. So that's one. We have piloted that and it's working. Now, under health and social care, what we have done in this country has never been done. The healthcare system had nothing to do with care of older people. Even the primary healthcare had nothing. So one thing we have done is to recognize that there's need for skilled caregivers to older people. What we have recognized that there's need to certify them so that you can monitor and evaluate. We don't have that statutory mandate. So we went to NBTE. We signed an MOU. And so far we have worked with NBT, Federal Ministry of Health, we had to sign an MOU on that, primary healthcare, all the associations, social works association, social works educator, nursing and midwifery council, everybody that is related to care, geriatric social care, all of us were together. We now drafted, first time in this country, the national occupational standard. That is the minimum standard to train caregivers. And we now have 5 levels of certification. And then we developed the standard. We have them, we're about to publish them, we already have them. We developed a standard for assessing care agencies. And a distinguished senator talked about sending out persons with cognitive impairments, not being part of the National Senior Citizen Center. I want to say that in that National Senior Citizen Act as well, there is provision for developing facilities. And in gerontology, when we talk about facilities, is to identify models of care agencies, the types. It could be nursing for those with cognitive impairment. It's still in that. So when you're sending away, send them to the facility that you have developed. We have respite care, where you can take parents there. Maybe you want to travel just 3 months so that the caregivers can have respite. It is there. We have independent living, where somebody, I'm old, my children are all gone, but I want the company of my peers. I can pack myself, sell my house, and go buy an apartment there and enjoy company. So we have identified all that, created the models, the standard operating manual, the curriculum to train the workers that we have all that. So what we are doing now at this time is to develop the portal for registration. Registration of these care agencies, let them know the certification, and then we are working very closely with NBTE on that. Now it is time for us to set up what they call the Geriatric Social Care Skills Sector Council. And that council is the independent assessor. It's not NSCC that will assess. NSCC, sets up that council with NBT. The assessors are multidisciplinary. They are professionals, and there's also CSO there. So what we have done is to bring tidiness to the care industry. And what this thing has opened is to open employment opportunities. So many things that you talked about, sir. are already programs we have developed. Everything, every single thing. We have developed those frameworks, and we will take this input and impute them as well.
Senior Citizens Center. Believe you me, if you depart from the objectives and fundamentals of this, nobody will listen to you. You must not dilute this agency with other things. Do you know why people listen to you and believe you have a point? Do you know why it is important to have this agency? It is because of the senior respect that is traditionally and institutionally given to the aged. Believe me, if you're going to take this agency and speak the manner you spoke for the next 1 month, nobody will understand where you come from. It is my belief that you know your limitations for the agency. The chairman politely told you that amongst us, a chairman of Agric, chairman of Population Commission, and the chairman of the Population Commission, you are going to use the agency, first of all, to be able to provide a census. You go to the National Park, they will tell you the census, the brackets. I'm going through the documents. As an agency, you must come readily available when we ask you how many aged persons above 70 are in Nigeria. And you must give us an indication of state by state. That you do not have offices in the state. It's not your fault, but it's the fault of the executive, and particularly you, who has not actually requested it. There is no way you have an agency of a national nature like this, and you don't have offices in the state. It is the offices in the state that will be able to liaise with the local government, and they liaise with you. This bill is not comprehensive and is fundamentally something is wrong with the bill. My advice going forward is get a consultant. There are a lot of gaps, and the frame of the bill is not what it ought to be. And if because the bill has not covered areas of interest, I knew ordinarily in the agency you talked about craft, you talked about farming, you talked about this. There are agencies of government that have covered these areas. But we understand where you're going from. You wanted, if opportunity arises, then the agency should be able to get involved in some of this craft, farming. But we're not yet there. We are not yet there. There has to be a foundation for the takeover of this agency, properly speaking. And that's why you could see the mega amount of money that the agency gets per annum. 300 million. Divided by the dollar today. What are you going to get? That means you are running an agency with less than $30,000 US for the whole country. And for the population of almost 37 million. I think you need a consultant. This committee will be there for you. We don't need to spend a lot of our time in the literature of what you intend to do, because we are not going to work outside the limitations of the bill. Even the bill you brought, as you bring it here, it's not comprehensive. The bill starts from chapter 12. The remainder of the bill is not here. So I think, as important as this agency is, it is our duty to tell you to sit down with some consultants and draft an amendment bill. And we can key in as a committee to be able to actually help ourselves. I say help ourselves. When you look at the senior agency center, it's supposed to be a center that caters for everybody. And it can't just be in Abuja. It can't be in Abuja. It has to be in all the 37 states of the Federation. So this is a huge thing that we are talking about. But the bill has not done justice to the intention, to the vision, and to where we are going. So we need to redraft the law. Positively, the law is passed. It's now an act of the National Assembly. So all that we need is just to amend some certain portion of this. Lastly, a lot of people will have quarrel with you and their reservation about defining an aged person at 70. When you retire people at 60, where do they belong? From 60 to 70, where do they go? They are young men, they are men, they are middle age. No bill takes care of the middle-aged men. So once you retire at 60, they are supposed to have been seen as an aged person, a vulnerable person, somebody that needs help, somebody that needs to cater for himself. But as traditional African society, we are not expecting to build amenities whereby when somebody is old, you take him there. I will never take my father there, nor my mother. Should be kept under my care, but not everybody has that kind of opportunity. Most people don't even have. So if you have a center in the state that regulates, supervises what happens in the local government, I think by and large in the next 10, 20 years, we be where South Korea. Have you been to South Korea? You need to go there. Have you been to Japan? You need to go there. You need to go to Singapore and see how they organize the aged citizen. And even in UK here, in most of the cities in UK, you have senior citizen home. We don't need to build the homes, but we need to bring to bear the knowledge that there is a need for the society to care for its all aged community. And that is very, very important, Mr. Chairman.
To our people here, the whole idea of aged homes or certain treatment for the aged is alien to some of them because of certain cultural or religious beliefs. So we need to see you integrate with National Orientation Agency so as to start creating the needed orientation of our people towards what you want to achieve. You've spoken very well, very laudable ideas, how you want to take it from ground zero to ground 100. But we must have some basics first. And also, like the last speaker said, confine yourself to some primary functions. With time, it will naturally evolve to some of the things you want to take it to. So please try and start looking at how you can have some relationship with National Orientation Agency so that people can even know the intent and the objectives of your agency and what you intend to achieve. Thank you very much.
Thank you most sincerely on behalf of this committee for the robust presentation that you presented, the report presentation you made to this committee. For want of time, we will not allow you to continue. We will now ask you to have a synopsis of these things to us. And I want to assure you, as a committee, we have taken note of all that you have said. We want to assure you, one, we are going to revisit the Act with a view to amending it. And secondly, the budget, 300 million naira, almost every senator that spoke here said it was grossly inadequate. Here is a country where the president of the country is an elderly person. We believe any amendment that was sent to him with his Renew Hope agenda, he will not waste time to assent with a view to uplifting the elderly persons in the society. So We are going to liaise with our committees of national planning, finance, and appropriation vis-a-vis the executive, so that we enhance your budget so that your aim could be achieved. Then, just like distinguished Senator Mustafa said, when we talk about orientation, even before he came, some of the 4 speakers spoke about that. It will not be out of place if you liaise with National Orientation Agency so that you can take the crusade or the campaign further for people to know. The amendment we are saying is very, very key. Just like Senator Abdul Ningi posited, you retire from civil service or public service either at 60 years of age or 35 years of service. So from there to 70, what would you do? So the amendment will look at these gray areas. And then we now also see what are the core mandate here in the Principal Act. What would be retained and what would be repealed and or reenacted. We'll look at all these things. So if there are any areas where you want us to include, kindly do not hesitate to send them down through the clerk of the committee. But I must also admit that you are doing a thorough job with the National Assembly, and particularly Special Duties Committee will stand by you, so that most importantly, you need to liaise with the chairman on national population and national identity and population, so that you can also, he will fast track in the senior citizens getting their need. You have to work with the chairman Senate Committee on Health, who is also a member of this committee. She told you her role in the health sector. The chairman Agric is here. You know, Judiciary is also a member of this committee. And Science and Technology, I've been talking of NBTE. The man that left, sitting next to me, is the chairman of Science and Technology. So by the time we are looking at this amendment, maybe we could even establish what is known as Board of Trustees, or agencies that will form the bedrock of the National Senior Citizen Center. So if these agencies are brought as members, even ex-official members of the board, I think you would now find it easy in administering the agency. So on this note, I wish to thank you most sincerely for honoring our invitation, and we are also appreciative of the volume of documents you brought. We will summarize it. We are expecting your report, maybe an interim report or a synopsis of a sort, so that we can now include on what we want to do. So I thank you most sincerely. We are also going for oversight. We'll look at your office, what you have on ground, and then where you also need our intervention. Thank you very much once again, and wish you a wonderful day.
And this is where we come to the end of the program from the National Assembly for this week. We thank you for watching. Join us same time next week for another package. Until then, I'm Lami Ali saying bye for now.